What is endometriosis? Endometriosis is a chronic and often painful condition where tissue similar to the lining of the uterus begins to grow outside the uterus. This abnormal growth can occur on the ovaries, fallopian tubes, the outer surface of the uterus, and other organs within the pelvis. In rare cases, it may spread beyond the pelvic region. Causes of endometriosis. The exact cause of endometriosis is still not fully understood, but several theories exist. Retrograde menstruation. This is the most widely accepted theory, suggesting that menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. The cells in the blood then attach to the pelvic organs and grow there. Embryonic cell transformation. Hormones like estrogen may transform embryonic cells into endometrial-like cell implants during puberty. Surgical scars. After surgeries like a hysterectomy or C-section, the endometrial cells may attach to the surgical incision. Immune system disorders. Problems with the immune system may prevent the body from recognizing and destroying endometrial-like tissue growing outside the uterus. Genetics. Endometriosis can run in families, indicating a possible genetic predisposition. Symptoms of endometriosis. The symptoms of endometriosis can vary in severity and may include pelvic pain, the most common symptom, often associated with menstrual periods. The pain may be more intense than typical menstrual cramps and can worsen over time. Menstrual irregularities. Heavy menstrual bleeding, menorrhagia, or bleeding between periods, monometrorrhagia. Painful intercourse. Pain during or after sex is common for those with endometriosis. Pain with bowel movements or urination, especially during menstrual periods. Infertility. Endometriosis is sometimes first diagnosed in those seeking treatment for infertility. Fatigue, diarrhea, constipation, bloating, and nausea, particularly during menstrual periods. Diagnosis of endometriosis. Diagnosing endometriosis typically involves medical history and physical examination, including a pelvic exam to check for abnormalities. Imaging tests, such as ultrasound or MRI, to create images of the reproductive organs. Laparoscopy. A surgical procedure where a camera is inserted into the pelvic cavity to view endometrial tissue. This is the only definitive way to diagnose endometriosis. Treatment options for endometriosis. Treatment for endometriosis depends on the severity of symptoms, the desire for future pregnancies, and the overall health of the individual. Options include medications, pain relievers. NSAIDs like ibuprofen can help reduce pain and inflammation. Hormonal therapies, birth control pills, hormonal IUDs, GnRH agonists, and other hormonal treatments can reduce or eliminate menstruation, slowing or stopping the growth of endometrial tissue. Surgical treatment, laparoscopic surgery, to remove or destroy endometrial growths, while preserving the uterus and ovaries. Hysterectomy. In severe cases, removing the uterus, and sometimes the ovaries, may be recommended, though this is usually considered a last resort. Lifestyle and home remedies. Regular exercise helps reduce estrogen levels and alleviate symptoms. Heat therapy. Heating pads or warm baths can ease pelvic pain. Dietary adjustments. Anti-inflammatory diets, rich in fruits, vegetables, and omega-3 fatty acids may help manage symptoms. Fertility treatment. For those struggling with infertility due to endometriosis, assisted reproductive technologies like in vitro fertilization, IVF, may be recommended. Living with endometriosis. Managing endometriosis often requires a combination of treatments tailored to individual needs. Emotional and psychological support, such as counseling or support groups, can also be crucial for those coping with this chronic condition. Endometriosis is a complex and often misunderstood condition. But with the right treatment and support, many people can lead full and active lives. If you suspect you have endometriosis, consulting a healthcare provider for a proper diagnosis and treatment plan is essential. Thanks for watching this video.